In the previous module, we have already learned and discussed about contraception and infertility, and now we will discuss some important points which are included in reproductive health problems and strategies. Okay, so India was amongst the first countries in the world to initiate action plans and programs at a national level to attain total reproductive health as a social goal. These programs, called family planning, were initiated in 1951 and were periodically assessed over the past decades. Improved programs covering wider reproduction related areas are currently in operation under the popular name Reproductive and Child Healthcare, that is RCH programs, creating awareness among people about various reproduction related aspects and providing facilities and support for building up a reproductively healthy society are the major tasks under these programs. Okay. Now, what is amniocentesis? Now, amniocentesis is a fetal sex determination test based on the chromosomal pattern in the amniotic fluid surrounding the developing embryo. Now, ban on this amniocentesis was there from the government because this sex determination was leading to female feticides and massive child immunization. Okay. Now, Saheli is a contraceptive pill which we have already discussed, and this was a oral contraceptive for the females and was developed by scientists at Central Drug Research Institute, that is CDRI, in Lucknow, India. Now, when we talk about population and birth control, particular terms we have to remember is that MMR, that is maternal mortality rate, and IMR, that is infant mortality rate. Mortality rate means the fertility rate or the death rate. Okay. So, we say that a rapid decline in death rate, maternal mortality rate and infant mortality rate, as well as increase in the number of people in reproducible age are probable reason for population increasing in India. Now, we will talk about a term that is MTP, that is medical termination of pregnancy or induced abortion. Now, this was legalized in India in 1971. Why this MTP is required? To get rid of an unwanted pregnancy either due to casual unprotected intercourse or failure of contraceptive used during coitus or rapes. Now, MTPs are also essential in certain cases where continuation of the pregnancy could be harmful or fatal for mother or child. It is safe during the first trimester, that is 12 weeks, and second trimester abortions are much more riskier. Okay. Now we'll talk about some of the sexually transmitted diseases. Sexually transmitted diseases are also called as venereal diseases or reproductive tract infections. Now, these are caused, various diseases are there and causative agents are there, so you have to remember the disease and the causative agents. Okay, like syphilis, it is caused by an organism that is Treponema pallidum. Gonorrhea is caused by Neisseria gonorrhea. AIDS is caused by HIV, that is human immunodeficiency virus. Hepatitis is caused by hepatitis B virus. Genital herpes is caused by herpes simplex virus. Genital warts is caused by human papilloma virus. Chlamydiasis is caused by Chlamydia trachomonatis, and trichomonasis is caused by Trichomonas vaginalis. Okay. Now, when we talk about these sexually transmitted disease, we have already learned about the contraception. So, now early symptoms of these disease are minor and they include a slight itching, fluid discharge, slight pain or swelling in the genital region. Infected females may often be asymptomatic and hence may remain undetected for long. absence or less significant symptoms in the early stages of infection, and the social stigma attached to the STD, that what is this, and this is really very embarrassing to go to the doctor for these kind of diseases, will deter the infected person from going from timely detection and proper treatment. This could lead to complications later, like pelvic inflammatory diseases, that the whole pelvic region will become inflamed, okay, the सूजन आ जाएगी, okay, that is called PID, abortions, okay, stillbirths and ectopic pregnancies, that is the pregnancies which are occurring in the fallopian tube, okay, infertility or even cancer of the reproductive tract. So STDs are a major threat to a healthy society. Therefore, prevention or early detection and cure of these diseases are given prime consideration under the reproductive health care programs. Though all persons are vulnerable to these infections, their incidence are reported to be very high among persons in the age group of 15 to 24 years. Okay, the age group to which you all belong. There is no reason to panic because prevention is possible, and one could be free from the infection by following simple principle, as you can see in the page. That is, first you should avoid sex with unknown partners or multiple partners. You should always use a contraceptive, that is condoms, during coitus, and in case of any doubt you should go to a qualified doctor for early detection and get complete treatment if diagnosed with a disease. Okay, and there is nothing, anybody can get diseases and the whole body, in the whole body, okay, so there is nothing to worry or be embarrassed of the diseases of the reproductive tract. So this was all about the fourth chapter, that is reproductive health, and the topics which are important are the contraception, infertility and the diseases, and you have to give a thorough reading of the reproductive health, population explosion and birth control, okay, and the MTP and sexually transmitted diseases from the textbook, and the main points I have already discussed here. Okay, so now next we will start with the fifth chapter, that is Mendelian genetics.